Hey, what's going on, everybody? I'm super excited to have what I would consider a friend, Dr. Junkins, on the call with us today. Dr. Junkins has been a client of Patient Care Marketing Pros, I want to say going on 3 years now, but I know that you've been friends with Michael Ray for much, much longer than that. Like in a previous life, you guys were already friends, but somehow we managed to reconnect. I got to meet you through that. And Dr. Junkins, you've just been such an outstanding client of Patient Care Marketing Pros and just a good friend to our company. So how you doing today, man? You good?
Man, I'm doing great. Doing great. Just humbled to be here with you and excited to talk to you about the business.
I love it, man. So, well, but before we get into any major details here, just give me a quick description of maybe the challenges and the frustrations that you were facing in your clinics. I'm going to say clinics because you have multiple before you started working with Patient Care Marketing Pros.
Well, some of the biggest things just revolve around myself as an entrepreneur, working with the details of the digital ads and the marketing space is not one of my personal strong suits. So, um, in today's day and age, we use a combination of marketing tools like some mailers with new clinics and things like that. More of the, I guess, what you consider in the older traditional ways, but the digital end of it, the website, the SEO, all of those things were really new to me. And I'm a very high level kind of guy, very big picture. And so a lot of the details that are required in the marketing aspect of it were just outside of my comfort zone. So growing the business, knowing that I needed to do that, was a challenge, which I had not been able to find in another partner before meeting you guys. Of course, like you said, I knew Michael from way back, and that's when I was up in Northeast Alabama, and he was there too. And then he left and deserted me, and then I found him again later, working with you down here, and that's when things really started taking off because pre uh, Patient Care Marketing Pros, we really struggled, or I really struggled with that aspect of it. We'd have an okay website, and we'd have a little bit of Facebook ads and some stuff like that, but nothing to the level that you guys have done. So, bringing you guys in enabled us to really focus on what we do, and let you guys do what you do.
Man, that's awesome. And I know Michael is a secret weapon. There's no doubt about it. So, uh, sometimes people just show up in your life. He's one of those people that I didn't go recruit. We just built a relationship and boom, he showed up. And you had been a part of that relationship for sure. All right. So let's talk a little bit about your experience. You've been working with us now going on 3 years, I think actually going on 4 years at this point, in some form or fashion. But what's your experience been like working with our team? Our client success managers, our service providers on our team. What's that been like for you?
It's been really great. And, like you and I talked even before we started the interview here, not to just purely make this uh, advertisement for you guys, but the honest truth is you guys work so well with what you do. For me to get in the weeds of websites and marketing and all that, it's a painful experience. But you guys take it and run with it. You're experts at it. You do a great job at it. So I think one of the biggest advantages that I've had since working with y'all, besides the personalities and the friendships that have grown through it, is the fact that you work very quietly in the background and it's seamless. Nothing. It's almost like it's like when we're getting ready to do a new clinic. Oh man, we got to call the marketing guys because y'all do what y'all do so well, that it's almost out of sight, out of mind. And I would say that's a big advantage for most people doing what I do, is because y'all do it so well. You do it behind the scenes, and things just happen. I remember when I first started opening clinics, before I had anybody really doing any of this, I'm chasing down that dang Google postcard and all that stuff, trying to find
Right.
it, get on the Google sites, and it's nothing. I mean, now we open a clinic, before we're even open, we've already got our, Google's confirmed and everything's moving along. So since working with you guys, y'all have taken the frustration and the headache out of that, and just do it seamlessly.
Man, I can't honestly think of a better compliment than not even knowing we're there. I mean that sincerely. I really do. Like, you don't even have to think about it. That's taken care of, and it's not a headache for me. I can go be about the business of being a doctor or running a team or opening the next clinic. I'm not thinking about who jacked up my marketing. You know
Yes,
what I mean?
exactly.
I'll
And
take that.
occasionally I'll go to the website. And it's like, oh, let me go to the website here and let me look at this. And it's like, oh wow, okay, wow, this looks great. It'll be something I haven't even seen before that you guys have just come in and tweaked. And I would throw this in additionally too, is like I said earlier, I'm not the greatest detail guy. And
Mm.
so I'll be scrolling through the website looking for something. And if I see something, I say, oh, wait, we need to correct this. Boom, send it to the support guys. And within a half hour, it's already fixed. And so that's the other thing is your customer support is so quick, so easy. So again, the word that just keeps coming to mind is seamless.
I love it. Yeah, those client success managers, we have a team of client success managers, and their whole world is to make it where you don't have to worry. And that's, I have to say, one of the most fun things that we've put into place here at Patient Care Marketing Pros is getting them in place to make sure that y'all are just well taken care of. So I love it
Mhm.
so much. Well, you've already told us lots of good things about how your clinics have grown and improved. When we first started working with you, we worked with one location and then we expanded to three locations. I believe we just opened number 7. Is that correct?
Actually, we just did number 10. You guys, I
Okay.
mean, it's gone
I
that
meant
far.
you
Oh,
had
wait, since
3.
y'all came on. Yep, yep.
Yeah,
Yeah,
yeah.
yeah.
That's
We
right.
started
That's
with
right.
3.
So
Yeah.
we
So
both, that's right.
yep, you're 100% right. Yeah, to be the 7th location that you guys have been with us. Yep.
Right, right. And I don't want to give away anything on here, but I know that you have a strategy to open multiple more here coming into the future into 2025 and beyond. So I'm super excited about all the growth that you're seeing. Math can be hard for me. You got to give me a little bit of break on that. You're right. It is 10 total clinics. I started with 3 and then moved from there. So that's
Yep,
where I
yep.
went.
But you picked
So
up all the original ones too. So
that's right. That's right. That's right. All right. So there's probably people that may be watching this, maybe people listening to this for the first time. Maybe they're considering working with us. What would you tell somebody who might be considering working with Patient Care Marketing Pros?
one of the things that I would say is to, if you're going to work with you guys, get ready to grow. The
Mm,
Because that's what happens is that when you guys take over the digital marketing, things just start happening. I mean, we can take one of our clinics, for example, that we opened middle of the year last year. When we opened it, the first month we saw just over 200 patients in May, and then by October we saw nearly 800 patients for the month. And
outstanding.
so, and that's been repeated over and over and over through each clinic. Your strategy of finding the sweet spot on the SEO and it just works. It works well, and I would say get ready for a collaborative relationship too. I remember one time when we talked with one of our older clinics, or I think it's the first one you guys took over for us. We worked together, and then I had this idea of, well, what if we did some marketing over in this geographic area? And we got together and we looked at the map and we said, well, hey, let's try it for a couple of months, and we saw a little bit of results. So get ready for a collaborative relationship as well.
I love the idea of the collaboration because we would like to be seen as your marketing arm, like your partner, maybe even part of your team, not just a vendor. That's huge for us. And here's the most important thing that I can say about you, Dr. Junkins, and the whole Southern Immediate Care team is y'all allow us to be that. It's one thing for us to want to be that, but for you to allow us to be that, that builds a bridge of trust, and it's been huge. And I can't thank you enough for that. Last thing, anything you want to tell the audience, whatever's on your mind about your journey, your success, working with us, working in general, anything you want to share with the audience?
Well, yeah, yeah, I do. And then before I say that, I want to back up to what you were saying about being a part of the team. And you
Mm,
may not even be aware of this, but on our corporate org chart, you guys are actually on our corporate org chart because we actually have
that's
that
awesome.
arm of our organizational structure is y'all being in that. So you're not just a vendor, you're actually on our team. So
I have to tell you what I'm going to do, and this may never make the final cut, but I'm going to put it in there anyway. I'm going to slice this little piece out, and I'm playing it for the entire team because they need to
great.
know they need to understand. I think everybody needs to feel like they're part of something bigger than what they really may know that they're a part of. You know what I
Oh yeah,
mean?
that's great. Yeah,
That,
because y'all are part of our team. Yeah.
I love it.
So,
Man,
but
that
no,
fires me.
yes, yes, and then I would just say that just like with other people who serve in a vendor type relationship, like I said, you guys are more than that, but in this business relationship, people will come, people will go, but there's and then I've heard it also said that the people that got you there won't necessarily be the people that finish with you, uh,
That's true.
but you guys will, because when we finally got to you is when things started working in this segment of our business. And so I would tell anybody, hey, not everybody is for everybody, but everybody listening to this, if they're considering any change, even if they're not considering a change, it's worth a phone call, it's worth a conversation, because between your expertise, your willingness to listen and to communicate, and just the fact that you're just a nice group of people to work with, and cool people. And let me tell you something. For anybody listening to this, these guys are not just vendors, and I know we've said that several times. They're friends. I had to go to the hospital a few weeks ago for a little minor procedure, and I get a get well card from my marketing team, and that those kind of things. I don't even think we've spoken because it's the holidays since I received that, but thank you. And you don't get that from just a vendor. You get that from people who care about you. And so I would tell anybody listening to this that it is definitely worth a phone call, if nothing else. But if you make the phone call, you're probably going to sign the agreement.
Careful with that phone call, right?
That's right. That's right. Be careful what you wish for.
Oh man, Dr. Junkins, thank you so much for taking some time and spending it with me on here, telling us a little bit about your story, man. I appreciate it so much. And I got to tell you, just personally, we were all thinking about you when we heard about that procedure. Again, I'm not going into any details, but when it came across, I'll say my desk, it's technically my Slack channel. There wasn't any question about it. What do we need to do? Right. And the team told me what we needed to do. I didn't have to make any of those decisions because they care about you. And that's awesome.
Well, I appreciate that. You guys are awesome, and you got a wonderful business, and it's just going to keep growing. And anything we can do to help it grow, you just let us know, because you've been the backbone of our growth.
Man, I love it so much. Thank you. Thank you again. I appreciate your time.
Hey, thank you, man.
All right.